As normal with these things, the slide won't share, so I think we're going to have to do a countdown. Alex is on the call as well, so Alex will just give us the nod when it goes live.
Dave,
yeah,
the slide's showing.
Oh, it is. Thank you. I'm on the wrong screen. Sorry about that.
Ready to start us? Okay. Welcome to this meeting of the Health and Adult Social Care Scrutiny Board, which is being live streamed. My name's Councillor Bob Piper and I'm the Vice Chair. Whoa, sorry about that. We just fell over. I'm the Vice Chair of the committee, and Councillor Giles, is the Chair, has been delayed and hopefully will join us as soon as she can. If all attendees could mute your microphone until they've been invited to speak, then it'll try to avoid any feedback we might have. If anyone does wish to speak, if you raise your hand in the raised hand feature, I'll try and keep an eye on it, or send a message, and you can use the chat feature and I'll invite you in turn then. When you finish speaking, just put your hand down and switch your mic back off. First of all, we need to invite people. So if I could ask members of the board individually to sort of say who they are and what they're doing here, and then we'll go to visitors. So first of all, as I say, I'm Councillor Bob Piper, the Vice Chair of the board. Elaine?
Good evening, everyone. Councillor Elaine Costigan. I represent Wensbury North Ward, but I'm a member of the board.
Okay, thank you. Kerry?
Oh yeah, I'm Kerry Carmichael, Councillor in Blackheath and a member of this board. Thank you.
Okay. Simon?
Hi Bob, can you see me?
No. Oh yes, I can see you now.
Okay, yeah, Simon Hackett, Councillor in Fire Park.
Okay, Sue Phillips?
Hi, Sue Phillips, Councillor for Charlemont with Grove Vale and a member of the board.
Thank you. Suzanne?
Evening, Councillor Suzanne Hartwell, Albury Ward and member of the board.
Okay. Are there any other members of the board that I've missed out there? Because I'm searching down this sort of participant feature and I can't see anybody else. So in the absence of that, we can go down other people who are in attendance. Deb, do you want to read those names out? That would help me.
Yes, Michelle Carolan, please.
Hi, yes, thank you. I'm Michelle Carolan. I'm the Managing Director at Sandwell on behalf of the Black Country and West Birmingham CCGs. Thank you.
Dave Bradshaw from Health Watch Sandwell.
Good evening, everyone. Yeah, Dave Bradshaw. I'm here representing Health Watch Sandwell.
David Carruthers.
Hi, afternoon, Dave Carruthers, Medical Director and Acting Chief Exec, Sandwell West Birmingham Hospital Trust. Hi.
Deb Ward, please.
Good evening, everyone. I'm Deb Ward and I'm presenting the Safeguarding Adults Board Annual Report.
John Taylor.
Good evening, John Taylor, Chair of Health Watch Sandwell, and here with Dave Bradshaw.
Sarabjit Bassi, please.
Hi there, Sar Bassi. I'm the Director of Primary Care for West Birmingham and, Black Country West Birmingham CCG.
Sue Redmond.
Hello, I'm Sue Redmond. I'm the Independent Chair of the Adult Safeguarding Board and I'm here supporting Deb.
Lisa Maxfield.
Hi there, good evening, Lisa Maxfield. I'm sorry, apologies, I'm late joining the call. So Lisa Maxfield, Deputy Chief Officer at Salmon West Birmingham CCG.
And Ruth Wilkin.
Hi, I'm Ruth Wilkin, Communications Director for Sandwell and West Birmingham Hospitals NHS Trust.
Okay, is that everybody done? Okay. I'd like to thank everyone for attending, but particularly those colleagues from health and social care who must be under tremendous pressure at the minute with the demands of COVID, and then say that your attendance here is very valued, really. We'll go straight into the meeting then with apologies. Have we had any apologies, Deb?
Yes, from Councillor Jarvis.
Okay, thanks. Item 2, members to declare any interesting matters to be discussed at the meeting. None. And the existence and nature of any political party whip and any matter to be considered at the meeting? No? Good. Okay, item 3 is minutes of the meeting on the 14th of September. Ask if someone would like to nominate those for approval.
Move it, Chair.
Thank you.
Chair, can I just come in there, please, Kerry? To say that I was sort of at the meeting last time. I had to change my password and everything to get in, so I was having issues.
I think I recall that. So yes, if we could add Kerry to the attendees and correct that, would be good.
Thank you.
Okay, I've received no notice of any additional items of business. So before we proceed, we want to move item 7 on primary care access forward. Who's presenting that?
It's myself and Lisa Maxfield.
Okay, do you want to get on with that? I understand you've got another meeting to go to, so we've agreed to bring that forward.
Yeah, I guess it's just to give an update around the whole primary care access issue, and I'll ask Lisa to come in as appropriate. Clearly, we're working with NHS England Midlands, particularly in making sure that primary care is open, its doors are open, particularly during this very challenging and difficult time. Clearly, primary care is working in a different way, probably across the whole of the Midlands area, probably across the country actually, and therefore what we're seeing is a shift to quite a lot of telephone consultation approaches first and foremost. There are issues across sort of the wider system, particularly in terms of being able to access primary care urgently, and our GP providers are still offering some elements of face-to-face, but trying to do as much work remotely and digitally as possible, obviously in terms of both from a patient safety point of view, but also from a staff safety point of view as well. We have seen quite an increased number of sickness amongst our primary care teams across the whole of the area, so it is something we're having to manage very carefully. And also alongside the fact that quite a lot of work has paused, particularly around secondary care, elective work, tests and diagnostics, that has a knock-on effect to what primary care can and can't do. So broadly speaking, we are trying to ensure that there is much business as usual. As we move into our very first vaccines, we're actually administered in primary care today in Halesowen, which is fantastic news for the area, the first in the UK, and a testament to how hard some of our primary care providers are working. They're obviously balancing that with business as usual and the day job, with also now ratcheting up our activity around delivering on the vaccine programme that's gone live, as I said, today in primary care. We've got 4 phases of development around the whole vaccine programme, which I'm sure Lisa can cover in a bit more detail. But broadly speaking, we are continuing to monitor, work with our CCG chairs and our primary care network clinical directors to make sure that the communication and the message is very clear that we are open for business across primary care during this challenging time, about the way we're working in a slightly different way, particularly in terms of that patient and staff safety aspect. Do you want to add anything, Lisa, at this stage? We aim to have a more formal report in January, but because of the challenges we've just been facing recently with sort of extended hours of working and also weekend working, helping to mobilise the whole COVID vaccine programme. It's been a very challenging time. Lisa, do you want to add anything?
Yeah, thanks, Sab. I think you've really summarised everything as we stand for primary care at the moment. I'm happy to give colleagues an update on the Sandwell practices who are vaccinating. So our first wave 1 site for Sandwell goes live tomorrow, and that's Your Health Partnership Primary Care Network. They're going to be vaccinating over 80-year-old patients starting tomorrow and through the week. And then we've got 2 other sites going live towards the sort of end of the week. They'll be getting vaccines, and that's primary care networks working together collaboratively out of 2 venues. I'm not sure if I'm allowed to tell you the venue at this moment in time. I do apologise if I am, but I don't know if I am, to be honest with you. But yeah, so they're going live. As I speak this week, they're mobilising to get everything sorted and start to vaccinate our very vulnerable over 80-year-old residents in Sandwell. I hope that's helpful. Happy to take any questions though, Chair. Thank you.
Yeah, thanks very much. You did say first, and I know you said something different second time around, that the vaccinating over 80-year-old patients, but you mean residents as well as patients, and it's not just inpatients?
No, I didn't mean inpatients, Chair. I meant patients of their practice.
Oh,
Not
yeah.
their practice, yeah.
Okay.
Or practices, should I say, plural.
Okay. Elaine, have you got a hand up?
Yeah, thanks, Chair, for that. Just a couple of things, really. Obviously, listening regarding the doctor's surgeries, I mean, I don't know about yourselves, but I am getting a lot of inquiries regarding doctor's surgeries, which I suppose we would be at this time. And I'm sure Health Watch is busier than ever because there's lots of more people asking for Health Watch his details. So that's a bit of a concern, but hopefully that can only get better. Yeah, there's a couple of questions I'd like to ask. How do obviously people get notified about the vaccination? Are we sending letters, cards, telephones? And you also mentioned in Sandwell. Well, that's a question we're being asked as councillors: is where will the sites be in Sandwell? Because it's clear Walsall Manor, they've already started, but there's nothing seems very clear for us in Sandwell at the moment. And I do think that we should be told where these places are going to take place. Thank you, Chair.
Who wants to answer that?
Yeah, I'll respond to that. So in answer to your first question, I think Saab explained the difficulties that primary care is experiencing at the moment. The majority of consultations are being taken over by telephone or video. And we'll continue to work with you around access. If there's particular concerns about particular practices, then we're more than happy to take that away and look into that and investigate. So please do keep in touch with us and let us know if there are particular practices that there are significant issues with. I'm happy to have conversations with our Health Watch colleagues. The second answer to your question, because it's all been very confidential, the vaccination programme, I'm not trying to be difficult in not saying to you where the vaccinations are taking place. I just don't know if I have permission to share that, and I think I need to go away and find that out, and I'm more than happy to send a written update of confirming that, but I don't want to break any confidence.
Yeah, can I just come in there? I guess a lot of the communications in terms of actual sites is embargoed, mainly for security reasons as well. So we're obviously releasing information as soon as we're given authority to do so, and that's not been difficult. I think it's a question of both managing the security aspects, but also managing patient expectations, because there'll be a limited number of vaccines that we're going to receive in this first phase, which will increase over time in phases 2, 3 and 4. So it's about managing both expectations and security and safety issues. But we'll certainly make sure we communicate as soon as we're allowed to, following that embargo.
Can I just answer your final question as well, Elaine, if that's okay? You asked about how a patient's being communicated. Because of the speed of the vaccine delivery, At this moment in time, patients are being telephoned and asked to book their appointment in. I think as we start to move through the waves, there'll be more letters coming to patients, but at this moment in time, our practices who are going to be delivering the vaccines are actually telephoning patients and asking them to come in and booking them in that way.
You okay with that, Elaine?
Chair, can I just come in on that? Obviously, is there any press releases going to be happening from yourselves, obviously to let particularly the older people know?
I think you'll see on Midlands tonight that they've been out and filmed a vaccination started in one of our Dudley practices today. I think we'll happily go away and talk about what communications we can share going forward. But as Saab said, it's been very controlled for communications because of the security aspects and the vaccine. So, but we'll take that away. Thank you.
Thank you, Chair.
Okay, Elaine. Simon?
Yeah, thanks, Bob. I'm going to be a bit parochial now, but I mean, in Fire Park, there's a number of residents who are above 80, and I just wanted to ask, logistically, how will this be done in terms of? I mean, there's a number of 80-year-olds across the whole of Sandwell. So how will it be done? Will it be town by town, or how would it be decided, or will it be based on what the current numbers are, if you like, in those particular areas? How will it be determined?
So all the GP practices have a list of obviously all of their age groups of patients and have collated that information. And then they'll be, so for example, the practice that's going live tomorrow, they've got nearly 2,000 over 80 patients. They've contacted every single one of those patients to identify if they want to come in for a vaccine and have booked them in. So it's being done through primary care networks. You'll know that primary care networks are groups of practices that are working together collaboratively, and they'll be doing that from as they get their patient list, and they'll be phoning them. You'll know that there'll be a number of patients who won't want to have the vaccine. We're trying to encourage that uptake, but effectively they all have their information of patients that belong to their practices, and that's how they're being selected. Councillor Hackett.
And because of the logistical challenges that the whole process of managing the vaccine carries, what we're doing is assessing the fitness of those sites to go live, to make sure that they're ready and to avoid ways to make sure they're staffed appropriately, etc. So they will be coming on stream in phases.
So can I just come back there, Bob? Just to confirm, so our patients at doctors' surgeries who are over 80, are they being contacted already? So it's happening right now, is it, that people are being contacted across Sandwell by their local GP surgeries?
Can I just be clear, Councillor Hackett, that it's not all practices at this moment in time. It's being done in waves. So wave 1 starts tomorrow in Sandwell. The practices, the patients that belong to that particular primary care network have been contacted, and the next wave of a number of primary care networks will go live on Thursday and on Friday, but this will be incremental. Just to make that clear, it's that it is being done in waves, and that's because of the vaccine delivery and how much vaccine we're not getting thousands and thousands of vaccines delivered in one go. It's not like the flu vaccine. It's a very different way this vaccine is delivered. So we're dependent on how the vaccine gets delivered, and that's how it's being selected in that way. I hope that answers your question. But I mean, the intention would be that all patients will be getting the vaccine. It's just being done in waves as we speak.
Okay, thanks for that, Lisa.
Thank you.
Michelle?
Thank you. I just wanted to come in off what the back of Lisa and Saab have said, just to confirm. I don't want to share what you already know, but just to reiterate, obviously there's 8 primary care networks across Sandwell, and because the ask had come down to primary care networks, it's Saab's point about the logistics. So some PCNs decided to do it in their own estates. So the primary care network that Lisa referred to is in wave 1 is using their own site to deliver that. Some of the other primary care networks decided to collaborate in more of a community aspect, and that required more logistics about setting up that lease, finding the right site, getting approval. So it's not that, you know, there was clear planning, and just wanted to make the point that that was a collaborative planning. So we've actually set up a vaccine cell under the auspices of the Sandwell Local Authority Incident Management Team. So all partners, you know, and Mark Davis from Voluntary Organisation, the council themselves, Lisa McNally from Public Health, they're all part of that cell. It's actually chaired by someone from the local authority. So we have been sharing constantly information about potential sites, sharing about what estates we could use that are within our gift to both health and social care. So we've been working really closely. So I know it's frustrating that, you know, you're saying to share those sites, but it's absolutely right that we make sure all those I's have been dotted and all those T's have been crossed in terms of leases, CQC registration. Does it meet the specification? And most importantly, are we going to receive the vaccines and on what date? And until we've got all those things absolutely nailed down, we don't want to release those sites. So it's not about it's a secret and we're not going to share. It's just making sure we've nailed all of that down. But just to give you some assurance, all of that is flowing through the vaccination cell, as I say, in that partnership space by the IMT. So we just wanted to give everyone on the call that a little bit of assurance of what that governance and oversight was.
Thanks very much. I've got John Taylor's got his hand up. Simon and Elaine have still got a hand up, but they may be historical. If they are, put them down. If they're not, I'll come to you in a bit. John.
Thank you, Councillor. It's perhaps a question for Michelle as well as to you, Councillor, but literally in the last 10 minutes I've had an email from Black Country and West Birmingham CCGs from Sally Roberts, the Chief Nurse, giving the sites of the PCN sites for the vaccinations as of today. So it's clearly going into the public domain. It doesn't say it's embargoed on the email I've been sent. I obviously don't want to embarrass the CCG, so I won't say the areas if this is a restricted email, but it certainly doesn't say that, Michelle.
No, I think that's wave one, John, that Lisa's just described for Sandwell, wave one in terms of your health partnership. So the wave one sites are in that communication. That's like, you know, we've shared that. There's just one for Sandwell. So yeah. That's the update that Lisa gave. So that's the stakeholders email that's gone out today from centrally from the communications from the CCG. That's correct.
Okay. You okay with that, John? Yeah.
Yes, thank you.
Okay. If you could drop your hand down again, then we can get going. Okay. Look, can I thank both of you for your presentation? I know you're both really busy at the minute, so thanks very much on behalf of all of us for coming along and updating us. And if you want to scoot off, feel free. Okay.
Well, thank you very much.
Many thanks. Happy to come back again as well, Chair.
Thanks very much. Thank you.
Thank you. Thanks.
Okay, we can move on now to item 5. Neil, this is you taking it first, isn't it?
Yes, that's right. Just bear with me 2 seconds. I'm just going to share my screen for you.
Restoration, recovery and reset funds update.
Yeah. Can I just check you can see that?
Yeah.
I've shared my slide. Yeah.
Yep.
Okay, great. Yeah, I was asked to just come and give an update on where adult social care was in terms of reset and recovery. So jumping straight in, I mean, clearly COVID is still very much a live issue for us and dominating a lot of our day-to-day work and day-to-day activity. And just to sort of pick up on the points where we're spending a lot of our time at the moment, the clinically extremely vulnerable support to residents. During the second lockdown, we resumed proactive calls to to people on our vulnerable persons list to identify if any low-level support was required. This, obviously, with the end of lockdown 2, could now come to an end, but we are still receiving referrals through the National Shielding Register, and as they are made, we're making contact with people to ensure they've got the right support in place and if there's anything additional that they need. The winter grant, I'm guessing you'll all be aware from Emergency Committee, was launched. It's a new scheme to provide financial support to families with children and vulnerable households and individuals so that they don't go hungry or without essential items over the winter period, and it runs from December, so it's currently up and running to March, and we've been allocated £1.4 million to make grants available to local people. Clearly, it's been a massive logistical effort to get this all up and running and moving in such a short space of time. So a massive amount of credit goes to the staff who've been involved in putting that system together so that we can administer applications and issue payments to people who are needing support. What I can update you on is that we've, since we launched towards the end of last week, we've received over 600 applications so far. I guess the positive in that is that people know about the scheme and are aware of it. However, it's slightly worrying that the amount of numbers, as this is an indication of how many people are actually struggling at the moment. Logistically, we obviously need to make sure that we can process and deal with those applications efficiently. In terms of lateral flow testing, kits are being rolled out across care homes and care settings. This is being done nationally in order of size. So at the moment, we've got very few care homes that have received their tests, and we've seen a slight delay in that, but we're expecting that those will begin to be received by the end of this week. And plans are also being finalised to have 2 lateral flow testing sites locally. And I think Lisa's on the call, so I'm probably come to Lisa at the end of this presentation for her to add anything from a public health perspective. We continue to provide ongoing advice and support to care homes and providers on any COVID-related matters. We're still seeing a demand from this, mainly due to changes in restrictions and regulations, implementation of new tier systems, and people and care providers wanting to make sure that they're doing things properly. Clearly, we're working together with our colleagues in public health to make sure that we do this as effectively as we possibly can. And as I guess you would imagine, there's clearly a big focus on the moment on visits to care homes, particularly over the Christmas period, which obviously links to the supply of lateral flow tests, as I mentioned just. We've provided the homes with guidance on using the tests to enable visits to take place. But clearly all staff need to be trained and competent in using the tests, both on the workforce within care homes and any potential visitors. And tests do need to be administered along with a robust risk assessment, which follows all of the latest national guidance. I guess we all recognise that people want to see their loved ones at Christmas after what's been a really long and hard year. But we also need to make sure, and we cannot escape the fact that people living in our care homes are the most vulnerable in the community, and for them this virus is particularly risky. And allowing visits to homes does bring with it the risk of infection. So we need to make sure we do everything we can to mitigate those risks. Infection Control Fund, we've distributed the second round of funding from government to support care providers with additional funding to implement measures which reduce the spread of infections during the delivery of care. That's going really well. And we also continue to monitor the impact the pandemic is having on our care providers through daily monitoring, which we've had in place some time now to identify issues early. We've also extended our provider offer to the market and made changes to our payment terms and contract conditions to reduce the negative impacts on cash flow in the market, as well as being available to have more in-depth conversations with any providers run into difficulty. So in terms of the delivery of services at the moment, we're implementing the discharge to assess model in hospitals, which is around speeding up the flow of discharge out of hospital. So we've had to make some adjustments to that. This has required us to get staff physically back onto wards to support the throughput of assessments and support discharges to be at a level to make sure that hospitals are supported to keep that flow of patients moving at what we know is a particularly difficult time of the year. Our day centres remain closed. We're still putting in alternative methods of support for people who are affected by this where it's needed. I recognise this is a difficult situation which can only go on for so long, so we are working on plans at looking at how a safe reopening of day services should look, because we're conscious of the impact this is having on both carers and people who would normally access these services. So we'll continue to work on that and look to resolve as quick as we possibly can. And then our other main focuses are sort of really where we are in terms of the time of year. So we've been putting logistical plans in place, how we make sure services continue to operate over the festive period. And clearly this is different to the usual plans we've been putting into place at this time of year because of the restrictions that we've got, the additional contingencies we need to have in place in terms of potential outbreaks. And also responding to different types of needs. So people with those lower level support needs who would normally be able to be supported by informal carers who could step in, and not having that availability because of the restrictions of people and households mixing, we need to make sure we've got those bits and pieces covered as well. And in addition to this, it's also the time of year which always brings with it a chance of snow. And we need to make sure we're ready for the implications on care delivery, particularly in the past where we've looked to transport people in our vehicles. We need to make sure we've got the risk assessments in place, that if we are doing that, that we're not inadvertently spreading on or passing on the virus in doing so. In terms of future challenges moving into next year, I'll jump back a few slides. In terms of future challenges moving into next year, we can expect to see that the response to COVID continuing well into 2021. Clearly, there's a lot of talk today in the media about a potential third wave, and we need to be able to respond to the implications of that. Financially, we already have challenges, but these will be exacerbated after the year that we've had. And whilst I recognise in our recent finance reports, we've been reporting an underspend for this year, what I would do is err a note of caution on that, as this isn't a true reflection, I think, of our financial position, mainly because of the numerous grants that we've had in place to support us during the year, but also because we're yet to see the full impact of any changes in people's habits in terms of their requirements for ongoing care, which are likely to be potentially more costly if people seek to move away from more group settings to receive that care. Clearly, the council is going to feel a squeeze in terms of finances, and adult social care won't be any different to that. Clearly, has been under a lot of pressure during the pandemic, and market sustainability is also one of the big. We clearly don't want to lose providers, and it's important that people have continuity of care, but also that they have a choice of where they receive that care from, and not to ignore the impact it has on the local economy when we start to lose care providers, which has already been hit really hard. So we need to make sure that we're having, we're continuing to have honest and open conversations with all of our market providers about how we can support them to adapt and remain viable moving across the next year. I guess one of our concerns in terms of what we also don't know is the whole picture in terms of safeguarding and domestic abuse referrals. And numbers appear to suggest that we're still receiving these as we would expect, but clearly until face-to-face contact and social interaction becomes back to a normal point, it's difficult to say whether we've caught all that and whether we may be hit with a spike in these areas. So we do need to monitor that closely as we move forward. And I think finally, sort of one of the future sort of challenges moving into next year is the potential for probably a more national debate about the relationship between health and social care. Clearly, there's likely to be discussions about how we continue to move closer together, and and we don't know how this will look. I guess from an adult social care point of view in Sandwell, our view is we've got really good relationships locally with our health partners, and we don't want to lose that, and we don't want to lose the good work that we've built on for many years. So we clearly need to be part of that debate and that discussion to make sure, if anything it does, it helps us to build those relationships even more, rather than taking away from any of that good work. I know Lisa's probably not prepared for this, but that was very adult social care focused. Lisa, I don't know if you want to say anything about the demands on public health, which obviously continue to be massive.
Yes, Neil, I can confirm that there is massive demands on public health. That's for sure. If you look at our case rates at the moment, we're doing pretty well. We are, last time I looked anyway, which is every single evening, we were 60th highest in the country in terms of the case rates per 100,000 population. We're around sort of 180 per 100k. Now the top of the table up in the southeast is over 500 per 100k. So relatively speaking, we're doing all right. But we are starting to see some early signs across the West Midlands of a turn back upwards again. And obviously, even though Sandwell had one of the largest falls in case rates over the last few weeks, we're certainly not immune to any rise up towards Christmas and beyond. Now, what that comes together with for us is a whole load of new initiatives that we're trying to manage. So we're trying to provide our health protection response, our outbreak response, which, as you know, is 7 days a week, morning till late at night. We're ready to take calls from schools, workplaces, care homes, etc. And of course, the contact tracing that we do. But on top of that is the vaccination work. So you heard about that earlier from our CCG colleagues. And in fact, I'm meeting with Michelle and the primary care networks tomorrow to discuss the council's input into making sure we maximise uptake of the vaccination. Because Sandwell on paper, you would predict Sandwell to have low vaccination uptake. We can't afford that. That would just replicate another inequality, because we traditionally see low vaccine uptake in more deprived groups. We see lower vaccine uptake in Black and Asian minority ethnic groups everywhere in the world, not just in Britain. And so we will we'll try and buck that trend and do everything we can to work with the PCNs to encourage and provide practical support, especially to older adults, to help them make the right choice and get to the vaccination site. We've also got the lateral flow testing, and that's been quite an experience, as we've been trying to get that ready for rollout at breakneck speed. The government announced it, as you know, only a couple of weeks ago. They said it'd be rolling out across the country, and Department of Health is still producing guidance tonight on how that is to be done. But we've had to really sort of build the plane as we're flying it in relation to lateral flow testing. But we think we have potentially a good provider in place who can work with us. And we're really hopeful we'll be able to launch a lateral flow testing hub at West Bromwich Town Hall to provide a lot of capacity right in the middle of the borough, and then work outwards from there, maybe creating extra sites around the borough, and also of course working with organisations to maximise who's being tested. So I can honestly say this has probably been our busiest period yet, and the thing that's keeping me awake at night is the next few weeks. You only have to look at the news to see the pictures of the shops being full, and then we've got this break in restrictions over Christmas where households will come together more. That inevitably is going to have a serious impact on infection rates. And with the NHS already struggling to manage demand, as it always does this time every year, never mind with COVID, we've got a tough few weeks ahead. And so we're trying to stay on message. We're trying to remind our local population that, of course, the future is very hopeful, with mass testing helping us recover and vaccinations helping us recover. But we've got such a challenge ahead of us, and we need everyone to sort of keep their feet on the ground and remember that possibly the next 4 to 5 weeks are going to be the most crucial of the whole pandemic in terms of determining our outcomes. So I'm happy to take Neil or Councillor Piper any questions on specific topics, but it really is about us all staying on message at the moment and urging people to be careful.
Okay, thank you, Lisa, and welcome to the meeting, by the way, because I didn't introduce you at the start. Also noticed that Elaine's on, so after this item you can have the meeting chaired properly. Got some hands in the air, so I'll go from the top. Simon.
Yeah, thank you, Bob. I mean, first, just say thank you to Lisa, because despite how busy you are, Lisa, you always respond to my inquiries when I raise them. I do appreciate that. So thank you, Lisa. But my question to Neil was, I was really pleased to see the announcement about the help, the financial help to vulnerable households. And when I put it on Facebook over the weekend, it's probably been one of the most shared Facebook posts I've put on recently. So obviously a lot of people out there are really interested in the fact that this is being made available. I know that people can apply online, and I know that we've also made it available where you can ring up as well for people who are not online. Is there any way we can proactively contact people? I mean, have we got data and we know who is eligible for this grant, so we can proactively contact them so nobody misses out at all?
Yeah, I mean, it's a good point, really. I guess through our colleagues in Revs and Bends, we'll hold a lot of information around sort of people on low income and in terms of the benefits they receive as well. So that'd be a good starting point. So yeah, let me pick that up with the relevant teams. We've also got very active welfare rights service who may be able to point us in the right directions and for people to contact. So I'll take that point and pick it up with a team who's administering and promoting.
Okay, thank you.
Thank you, Neil. Kerry?
Thank you, Chair. I have a number of questions for Neil. Is that okay?
Yeah, carry on.
Thank you. Going back to that winter grant thing, you did say you had 600 apply. I was just wondering how many have you paid out so far? Or when do you expect to actually make the first payment, or when will the payments end? Because people are obviously desperate.
Yeah, the first payments have already started being made. So we've got an agreement in place with PayPoint, so that people can get the payments from any PayPoint registered site. In terms of the amount of payments, I'd need to get the exact figures on that and the timescale. Like I say, I think it was more than we were expecting, and we have got a system where people can get the PayPoint, or they can get vouchers as well. Vouchers are just being finalised. Hopefully they'll be in place by Wednesday this week. So let me come back to you with the numbers and the throughput on that. I had a conversation with the teams who were sort of dealing with the administration on that. Obviously, like you say, we recognise that people who are applying need a response, and they need a response quickly. So we're gearing up teams to, pick up applications, evenings, weekends, moving right through to next week to make sure that we're getting them done as quick as possible. Okay,
I'd like to know how quick that possibility is, though. You see, I mean, from start to finish. That would be a good one, Neil. Thank you. My next question was, how many people have we got in care homes at the moment that will require the lateral flow test?
So the lateral flow test isn't, when we talk about lateral flow test in care homes, that was more around supporting visits to care homes and testing anybody who's potentially coming in. Lisa, I don't know if you want to just come back in, because you've been more involved in the arrangements about the use of lateral flow testing around care homes. Sure.
Yeah, Neil, I mean, you're right. So, Councillor Carmichael, the primary use of the lateral flow tests will be for visitors in the first instance. it gives you some indication. Don't forget the lateral flow tests, as you will have heard, are not quite as sensitive as the PCR tests, but the big advantage they have is you get a result there and then. So the lateral flow tests, we're going to focus on visitors coming in because it's better than not testing at all. But we're going to be really careful to make sure everyone knows that we still follow all the infection control advice. There'll still be distancing and PPE and everything. We can't take chances in care homes. We probably will do some lateral flow testing with residents, but still the main element of our testing with residents will still be the traditional PCR, because with residents we're less in a rush for the result. We just need to regularly test them. So it will be horses for courses, and we'll choose the right test for the right scenario.
Okay, thank you. So how many people do we have in care homes at the moment? Do we have a lot? Just wondering how many.
I don't have the number
on visitors.
Yeah, I mean, in terms of the allocation of the tests, they've been allocated nationally on the basis of, I think it's 4 tests per resident per week. So that's the number of tests that we're getting coming through. So, I mean, I can get you the figure on the number of residents. But yeah, that's been the formula for allocating those tests centrally, I believe, and that's Lisa tells me that wrong.
What I can give assurance on, Councillor Carmichael, is that we've submitted the numbers that Neil and I have in our head at the moment about how many people are in the care homes, and our receipt of tests is designed to match that. So what I can assure you is there won't be a shortage of tests, either lateral flow or polymerase chain reaction tests to cover residents, visitors, staff. You can't move for tests right now, and so we certainly have enough to cover as many care home residents, visitors and staff that we have.
Okay, thank you. And another question to Neil is your infection control fund, who has had this and how much have we given these people? So I would imagine that how many providers do we have in Sandwell? And has it been shared equally, or have people had less, people had more?
Yeah, it's been done on a calculated basis of how many people the providers are actually supporting. Now, because obviously we don't commission the providers and all the packages of care in Sandwell, people who are self-funding, they commission their own care and support. We have relied on returns from the providers to issue those payments. We've issued all of the we have to issue we have to allocate the fund within 20 working days of receiving it from central government, and we have to submit a number of returns to confirm that we've done that. I need to get back to you on the exact figures of what's been allocated to who, because although we've got the providers, they need to fill in the return to allow us to make that payment. Because, like I say, we don't commission them all. The ones where we commission ourselves, so obviously we do commission a large majority of the care that's delivered in the borough, we've just been able to issue those payments straight away. Yeah, I can come back to the details on that. That's been a fairly smooth process, because this is the second round of funding that we've received in terms of infection control. We've replicated the same process as we used the first time around.
Okay, thank you.
Lisa, do you want to come back?
I wouldn't have slept tonight if I didn't get Councillor Carmichael an answer to a question. There's nothing I hate more than not knowing the number of something.
That's me.
So thank you for the challenge, Councillor Carmichael. The answer is 1,289. 520 are in nursing homes and 719 are in non-nursing care homes. And the only reason I know that is because the other day I asked someone to get that number so we could calculate the vaccination need. So I feel better now. So.
I have to know numbers as well, Lisa.
Yeah.
It's terrible. I do have one number question for Neil, and that is, you did mention that risk assessments and stuff, have they been completed?
The risk assessments for visitors going into care homes.
Yes.
So the guidance has been sent out again on visits to care homes. I think generally there'll be a risk assessment by the home in terms of their infection control measures, but also they need to do a dynamic risk assessment for anybody coming in. Lisa, again, is this something you want to step into because you're a bit closer to it?
Yeah, so we've essentially given the go-ahead for care homes to allow visitors in, and they need to tick 2 criteria set by Department of Health and Social Care. One is that risk assessment that you're talking about, and they've all had the form and they're sending it back as we speak, and we're looking at them and offering advice. I think we've had 10 or 12 back so far. We want to leave it to the care homes to go at their pace, because if we rush them, we don't want them to cut corners on their risk assessment. The other criteria they need to hit, of course, is the one we just talked about, having lateral flow tests for visitors as well. So obviously all the tests are being made available to them, and they just need to confirm. So it's a work in progress, but ultimately it's for the care home to decide when they're ready to go, and we're just there supporting and giving the advice. But we have given the go-ahead to all homes to open up to visitors, as long as they meet the Department of Health and Social Care criteria. And that's important from not just a public health point of view, but of course a legal point of view for the council. So.
Okay. Thank you. Thank you both. Yeah, thank you.
Is that it?
Yeah,
Okay.
thank you.
Okay. Elaine Costa.
Thank you, Chair. Yeah, just a couple of things for Neil. He's under the cosh tonight. He's used to it. Yeah, just a couple of things really. And again, I'd like to thank Lisa and Neil for responding to our emails pretty quickly. Yeah, I'd like to. I'm just curious really as to how we're doing compared to other boroughs, and obviously our reset and recovery. How often are they still meeting? And it mentions day centres that remain closed, but yet private day nurseries remain open. So we're just trying to compare what is the difference between the private sector remaining open and the council day centres not remaining open. Thank you.
Okay, so if I take your last question first, that's probably, so in terms of day centres, I'm not referring to day nurseries, it's more of where our some of our learning, our clients with learning disabilities or severe profound disabilities need that day-to-day support. So you can imagine, given the vulnerabilities they've got around their health, putting them all back into one space at the moment is particularly risky and particularly challenging. So we haven't got any day centres operating at the moment in Sandwell, whether it's private or council. We've worked with our providers to make sure they're offering more tailored individual support to people who would normally access those services if their family care support needs additional help. Clearly, the length of time this has been going on is starting to create a strain on carers. The carers need support, they need a break as well, which is why I say we need to start having those discussions about how do we just say we can't keep centres closed forever, and because of the pressure it's creating on carers. So we are starting to look at those plans. Apologies if I wasn't quite clear in the presentation about the difference in that. In terms of our reset and recovery, we're meeting every fortnight, which talks about all reset and recovery across the council. Still looking at the safe restart of services. I guess we were in a more fortunate position than when we came out of the first lockdown in terms of the fact that a lot of the services that are facing now have got risk assessments in place, which Lisa's team and our health and safety team have looked at. So when we have to scale back services but then restart quickly, we should be able to do that more effectively because those risk assessments should still take effect. We just sometimes need to adjust them to fit in with national guidance, but we're still having those conversations on a regular basis, and keeping an overview of what services are operating and how they're getting on to make sure that everybody is being protected as far as possible.
Is that okay, Elaine?
About the first question, I mean, obviously you've talked about, you know, the carers with children with learning disabilities. It's imperative, I think, that they get a lot of support. Obviously, you're talking about going forward. You know, they can't remain closed forever. Totally agree. So, how are we doing then compared to other boroughs? Do we talk to other boroughs to see what difference that there is between us and them?
Yeah, I mean, we're in the same position. Other boroughs, our local neighbours, are just starting to look at reopening their centres as well, and doing that in a planned way. So, you know, anything that we can adopt in here as a similar approach, being consistent, any learning that we can take from that, we do. But we are pretty much where everybody else is at the moment. You know, we just want to make sure that we've got the right support in place, and that anybody who, you know, when we do open centres, that people aren't at risk of the virus, because given the health conditions or the underlying health conditions that people generally have, it could be really disastrous for them. So we're just treading with caution, but we're not out of step with our neighbours on that.
Okay. Thank you. Thanks, Chair.
Okay, Elaine. Okay, I've got no other hands, so presumably no more questions. Can I thank you, Neil and Lisa, for that? Again, much appreciated. No busy you are. Michelle, I think we've got a presentation from you now, or a verbal presentation on an update from the CCG. Yeah?
Yes, thank you, Chair. So this is just a kind of a context of our approach at a system level as well as locally to restoration and recovery. And I know that David has got a presentation in some of that local context from a delivery perspective. So similar to how Neil described, at the CCG we have an internal weekly restoration and recovery, not just for our acute trust, but all of our services that we commission. But we also run a system call. So actually it was this evening. It happens on a Monday at 4:30 to 5:30, and we've got representatives across the whole STP footprint, not just CCG. So local authority, public health, everyone's invited to come and partake in that restoration and recovery at a system level to make sure, you know, it's Councillor Costigan's point about are we in sync with our neighbours, and that's the whole point of that STP approach, so that we know it's a black country approach rather than just being you know, Wolverhampton doing one thing and Sandwell doing another, that we're all in sync with how we're standing up and recovering those services and the approach that we're taking. And that's really helpful because, you know, our residents and our citizens don't fall into neat packages of different local authorities and different health providers. So having that joined up approach we found is really helpful at an STP level. So that call was this evening. A pack goes out. I think Lisa's on that circulation prior to Stuart leaving. It was Stuart. I think I don't know if Neil's been linked in. If not, Neil, let me know and I can link you into that. So we look at all of our providers and where they are in terms of those services from a local perspective. And I don't want to steal David's thunder in terms of some of that detail, but I think it's fair to say in wave one, many trusts across the country stood down a lot of routine activity. Certainly from an acute perspective, Sandwell and West Birmingham didn't do a carte blanche approach, and they tried to continue as much as possible. Obviously, in the summer, we instigated the restoration and recovery. Since then, there's been a subsequent wave, but we still tried to continue with that restoration and recovery because people still want to have their planned procedures. I think the biggest challenge we've seen is people not always wanting to come back into that clinical setting because of some of the risks, especially with our more vulnerable cohorts. And it's how we can really communicate with our citizens that, you know, with it being called in from a clinical priority perspective, that it is safe and we have segregated our environments and there is a common sense approach with the flow of patients and the activity. So our clinicians and our colleagues have been working quite hard to get those important messages out to our citizens to make sure they feel confident in coming into services and using them again. And we've seen that kind of take a spike now in some of our A&E performances that we're seeing back to regular levels. You know, during wave one, it went very quiet, so we are seeing those returning. And from a primary care perspective, we're absolutely flooded with that demand coming back in. And again, during wave one, it dropped off significantly. So a lot of challenge in terms of that access now. So that's the kind of approach from a not just a CCG, but a system level to R&R as we're referring to it, but also as we move towards the end of the financial year, about kind of a reset as well, because we recognise that there's been a huge amount of learning from COVID. I know it's been, you know, devastating in one respect, but there has been a lot of learning from it as well. We've moved more rapidly than we could ever imagine from a health and social care perspective, and some of those things we don't want to lose. You know, the digital technology, remote. I'm not saying all of it is the preferred option, but certainly a blended approach. There's lots of people that have found it much more beneficial to be able to access services remotely, and so we want to keep that where we can. Also about the way we've shared information with each other and worked together as a partnership. We've always had a good partnership from a Sandwell perspective, but we don't want to lose that as we move into the next stage, if you like, of that reset. But I think the most powerful thing we've learned from COVID is about the inequalities that exist, and how we can take the learning from COVID in particular to our inequalities, which is really, you know, for Sandwell and anyone given our demographics, to make sure that we really embed that into our thinking as we go into that reset period, looking at, you know, how we want to deliver our services, what impact, what difference are we going to make to our local people. And that's, of course, the whole premises of the integrated care partnership that we're all part of in Sandwell. I won't talk too much else about local services, because I know David will probably mention that in some of his presentation that he's got next in terms of that local context. But I just wanted to give you a real flavour of the approach that was being taken. I think it is a joined up approach, but I'm happy to take any questions before David, or you might find it helpful to listen to David first and then take questions at the end, whichever's most easiest for you.
Any questions? I've got no hands in the air, so perhaps if there are any questions, we'll take those after David's presentation. So thank you, Michelle. Elaine, do you want to assume control of your committee?
All right, if you like. I'll take over if you want. It's up to you, Bob.
Yeah, carry on.
Okay, we're going on to item 6. I'll hand over for David for Sandwell and Birmingham Hospital Trust.
Hi.
Hi.
Let me just. Can you see the presentation?
Yeah.
We can see the end of it, David. So if you scroll
okay,
up.
that's I can be quick, but not that quick. So okay, so thank you. Just give you a bit of update on the possible performance, really, and then some general text slides. And I think what we're seeing here is some data going all the way back to April on patients in the organisation. I think the red line is probably one which reflects how busy things have been, because at peak time, and you can see in November to the far right of the screen, we had over 240 patients in the organisation with COVID, and that was higher than we had at peak back in March, April, where we only just reached 200 patients. So the volume of patients being admitted with COVID has been greater. That's falling off now and is about 180 patients and is reasonably stable. The difference between this time and last time is that we still have many admissions with non-COVID related.
Can I just interrupt, David? We can't see that slide. We've got the last one out the three. Thank you. Can everybody else see it?
Can you see that now?
Yeah.
Yes, that's now, yeah.
So, okay, thank you for interrupting. Sorry, I don't know why it didn't change. I'll leave it on this on just like this so that it sticks with what I want to show you. So basically, yeah, more admissions with COVID than we had before, more inpatients, but only a third of the admissions are COVID related, 2/3 are non-COVID, whereas in the first wave, it was virtually only COVID patients we're getting in the organisation. So you can see how busy it's been, and partly because of that, and partly because of the number of patients in intensive care, and you can't really see the numbers because that's the green line at the bottom, but our intensive care has been over its normal capacity of patients. So because of the need for medical beds and the need for staff to help support intensive care, we have had to scale down some of our routine surgical services that we tried really hard not to do, but we needed the ward space and the nursing staff and skills to help with the medical admissions. So those two numbers, the red and the green, reflect how busy the organisation has been. The solid blue line is unfortunately the number of patients who have died at Sandwell West Birmingham of COVID-related illness, and I'll come back to that with some more data in a while. And the top line is the number of staff who have had to go off sick because they've had COVID as well. Some of that will be community acquired, but some of it within the hospital. Now, I've changed the slide. Can you see that?
Yes.
Yeah, you got some data slides. So when we compare wave 1 to wave 2, there are some slight differences in the demographics. We probably had slightly more Asian patients admitted in wave 2 than wave 1. The gender split is still 50-50, but the big change is the age bands. We've had a younger cohort of patients admitted. So the first number in less than 64 years. In wave 1, 43% were under 64, but almost 60% are under 64. So we've had a younger age group of patients being admitted this time. Over time, month by month, the number of patients over 85 has actually increased, and the younger patient number has decreased. So we're seeing overall younger patients, but gradually over time we're seeing more elderly patients being admitted. There's still a high frequency of patients with high blood pressure and diabetes, and those who do unfortunately die. But one of the big differences is that during the first wave, about 30% of patients who admitted to hospital unfortunately passed away from COVID, but now that number is only about 13%, 1-3. That may be because we're seeing a younger age group being admitted, or it may be a change in the approach to treatment because of research studies with use of steroids, some antiviral agents, blood thinning medication, and different approaches to using oxygen therapy. So the outcome is better. Though we're seeing more patients being admitted, they're younger, the outcome is better. And still being male, those 50-50 split between those being admitted and being male have a worse prognosis, and the ethnicity of those patients who die is equal to the percent for admission, so there's no obvious difference there. So that was just a little bit of data to show where we are and how busy the organisation has been and why some services have had to be stepped down. To help manage things, all patients are tested on admission and during their admission at other times. There are different forms of testing system being used, but they are being tested regularly. I talked about the treatment pathways. Proning is where patients are nursed on their front using positive pressure CPAP to help oxygenation rather than putting them on the breathing machine, and the use of steroids dexamethasone. We've already heard about virtual and telephone consultations, and we have been able to maintain diagnostics and some surgery at the Birmingham Treatment Centre at City Site, and this is our green or non-COVID area. So we've done very well to keep up with diagnostics from an imaging point of view. Some things are a little bit behind still, particularly endoscopy because of the complications of the procedure. And some services that were still based out at private facilities will be moving back to the trust, but we're based at City Site, and that's haematology oncology, but that is because the site move is because we can use single ensuite side rooms at City Site that we don't have so much of at Sandwell, which will help reduce infection risk of this vulnerable group. So there's a lot of text here. I'm not going to go through all this. I think you've had them printed, but lateral flow testing is offered to all patient-facing staff twice a week, and you've heard about that in relation to care home visitors. We're involved in supporting Walsall with COVID vaccination process as well as the primary care networks. Some of our staff will be able to get vaccination through at other sites, particularly that at Walsall at the moment. Working hard with staff to make sure that they reduce the risk of infection to themselves and to patients, and particularly staff wear masks at all time in shared areas. And we also ask patients to do that as well to help reduce the risk of hospital-acquired infection. Supporting staff is important, particularly around mental well-being, because of the stresses working in the environment at the moment, and very much aware of the support we receive from local communities as well. So thank you for that. I think it is really important that, you know, we do maintain confidence in the population to attend for diagnostics and outpatient appointments where that's necessary, and to attend ED where necessary. As I say, that is definitely happening now. That didn't happen during wave 1. We have had to pause some of our non-urgent procedures, and I explained that earlier on. Visiting is still restricted, though we're reviewing that, and we'll certainly relax it over Christmas, though we'll monitor it very carefully to reduce the risk to visitors and patients. But I think the message is still there around social distancing, hand washing and face coverings to reduce the risk of infection, even you know, as we progress with the COVID vaccine. So that was all I was going to say. I'm happy to pick up any other questions with Michelle on that or any other issues. And let me just close these down.
We got any questions? Elaine Costigan?
Yeah, thank you, Chair. Yeah, interesting, David. Can I just ask a question regarding visitors? You mentioned obviously there's still no visitors, but how are we monitoring people that are just like popping a newspaper into the site, especially Sandwell? I mean, do we, you know, there could be somebody there that sort of should be isolating, that may be going to the hospital taking a paper. I'm just wondering, how do we try to monitor that? I know it's difficult.
You know, people, all staff visitors are asked about current symptoms as they enter the hospital through without, with security and with staff to help support them in giving anybody who comes into the organisation to wear a mask and to alcohol gel their hands, and anybody who is symptomatic is asked not to attend, and we just have to rely on the public to do the right thing if they are symptomatic. But anybody who comes into the hospital building gets given a mask and alcohol gel in their hands, and visiting, if it is happening, is limited, and all visitors are screened before they're allowed in.
Thank you.
Is there any more questions? Kerry?
It's not so much a question, it's more of a comment really, and a bit of praise. My mum was actually in Sandwell Hospital last week, not for COVID related issues, but I must say everything was so professional. She was put in a side ward, tested before she was let onto the ward. We needed to take things to her. We was made to stand outside and somebody come and greeted us, took the bag off us. You know, so it was really professional, really well run. I was really pleased with it, to be honest. So thank you.
No, well, thank you for that, and hope your mum was okay and got out okay.
Yes, she did. Thank you. Excellent care. Excellent.
Thank you, Kerry.
I say that for City as well, because I've been up. My husband's been at City for a few days, and I've got to admit his care was good as well. Very good. Elaine, have you got another question?
No, Chair.
You just don't put your hand down. Anybody else with any questions? No, David. So thank you for that report. And it's
okay. Pleasure. Thank you.
We've got plenty PPE as well, and we ain't going to have the problems we had if we do have another spike. Okay. Right, we'll go on to the next next item, which is Sandwell Safeguarding an Adult Board, and that's Deb and Neil. Bring the report.
Good evening, everybody. Thanks very much I've just asked Neil if he could share his screen because he's better technically orientated than I am, so you can see my very brief presentation. And I would remind people that Sue Redmond is on the call as well, who's the independent chair of the Safeguarding Adults Board, so she may want to comment as I talk us through our presentation. And I would just like to say that I'm going to do something just a little bit different this year. Some of you may well have been at Scrutiny when I've done previous reports on the annual report. You will know, and you can see on the front slide there, that the annual report is retrospective, so it's about the year previously. So I put in the presentation some headline stuff that will help us understand some key information, but I also wanted to talk a bit about activity that the board is supporting this year, given the particular challenging nature of the year that we've had, really. So I hope that you'll support my indulgence in that and get an understanding of how we're trying to move things forward. So Neil, could I do the magnanimous phrase of next slide, please? Okay. So if you see there, I put some highlights. So board membership was refreshed earlier, last year, sort of midsummer last year, in line with the peer review recommendations. And the peer review happened in 2018, so a very long time ago now, but actually the board has been refreshed to ensure that there is more senior representation from all our partner organisations. So what that means is we've got a smaller but more senior board, and so people on that board, Safeguarding Adults Board, can really make commitments on behalf of their representative organisations. In line with that, we've revised governance arrangements for members so that members are clear about what's expected of them and how they support, as a board, the delivery of agendas. And the annual report, which I'm talking about, has been co-produced with all partners as part of that board arrangement. So it's not just something that I or one single agency has put together. And we've continued to be represented, so some of Safeguarding Adults Board has continued to be represented at both a regional and national level, both myself and Sue and members of the business team. And I think that's really important because it gives Samwell every opportunity to either showcase the good practice and lead on best practice, and it also gives us a sense of where we are in relation to our peers within the West Midlands region, particularly the metropolitan area. So just picking up on some of the points that have been made in earlier presentations and discussions, I think it is important that we get a sense of what's happening in Samwell as it relates to our partners. So next slide, please. Thanks. One of the key things that happened was we employed a development officer. His brief is to really specifically work alongside and hear messages from people who use services and people who work in those services. So as a board, we get a real sense of what are the things that are important to people in Samwell on the ground, and what additional assurance might we need to seek in order to really help people understand they are being listened to. Again, the board is supported by 3 key subgroups who continue to work on identified priorities, and there is evidence of the progress of that activity within the annual report that I understand you've all had copies of. I've also undertaken a review with partners of all learning identified within any statutory reviews that have taken place in Samwell between the identified period there, so 2018 to 2020. And that's important because actually we need to understand what that learning is and how we can better work together to ensure that that learning is live, and we work with colleagues to embed it in practice rather than just doing pieces of work that then sit somewhere and no one ever really looks at them. And we have, as a business team and partnership participated in a regional review of dashboards, and that's the mechanism we use to help us understand what data we have and what in addition we may need to know and what else we'd like to know, depending on the, particularly now, the ever-changing picture. And so, as I said there, key information around safeguarding. And I haven't said it here, but it's actually true. The Sunwell dashboard was cited as a particular piece of really good practice. And so other colleagues and peers across the region are learning and continue to learn with us on some of the things that we are doing here in Sunwell that are giving us positive data and positive information. That's not to say, though, that we don't need to continue to improve, and certainly around getting qualitative data, so understanding people's experience as well as understanding the numbers and what they look like. Okay, next slide, please. So again there, then just a brief overview of what our data is telling us. So it's telling us the number of safeguarding referrals being made are increasing, and more of those referrals become a full safeguarding investigation. So what that means is the referrals that are being made are appropriate, and that actually people are working together to really be alert and aware as to what safeguarding concerns there are, making those referrals. They're then being acted upon and being investigated thoroughly. And I think particularly now, that's a form of assurance that we should feel confident in. 38% of all abuse in Sunwell happens in a person's own home. Now, although that's alarming, that's not out of step with other areas within the metropolitan West Midlands, and actually it does represent a reduction in Sunwell. So the activity that is taking place to help people understand what abuse is and how to report it, I would suggest is having an impact, because we're seeing a change in that figure. So in 93% of all safeguarding inquiries, the risk to the individual was either reduced or removed. And again, I think that's really significant. There is, though, still room for improvement. And I think moving forward, those are some of the areas around risk management that we want to pursue getting assurance on. And 84% of people who were asked said that the support services they received helped them to feel safer. And actually, that's really critical, isn't it? Because we wouldn't want to think that support was being provided to individuals and it was actually not making a difference. We've got some evidence to suggest that the support that is being provided is helping people to feel safe. Okay, next slide, please. So looking forward to 2021, this is the bit where I think I'm doing something a little bit different. So I've just said, what a year, because it has been, hasn't it? And we've heard that from our partners as well on this call. And so as the reporting period ends, so the reporting period for my own report is March to March. So as it ends, the pandemic hit us all. So as a board, we've changed our ways of working, and Sunwell Safeguarding Adult Board now meets every 6 weeks. And all meetings today have been on Microsoft, so they've all been virtual meetings, not unlike this one. And what that's meant really is, as an observation, is that partners are able to engage more easily with one another, and board members continue to be galvanised, so really robust around action and focus, seeking assurance consistently about how people with needs for care and support continue to be safeguarded, because a particular challenge now is that people are less visible to us, aren't they? We're not necessarily going out and about in the way that we were, and that would also include people with needs for care and support. As we've heard from Neil and others, day services remain closed for reasons of ensuring that people with multiple premorbid conditions are not placed at greater risk, and also that carers are remaining at home in order to provide that support. So again, there are examples of people being less visible, and how we then need to be more vigilant about what we understand about safeguarding in order to constantly be thinking about those individuals and really, and I think I say this later, making every opportunity count. Next slide, please. Oh, I'm going to just move to my phone. Oh, thank you. Hopefully it was you, Neil. So I think, and I think I've touched on this already, technology has enabled key messages to be produced quickly and circulated across a much wider footprint. An example being information being made available to volunteers in a range of formats about what to consider when having some contact or seeing people in terms of adult safeguarding and how to make every opportunity count. So, along with some of our regional partners, we've also produced sort of workbooks and key things for people to think about who perhaps would never have thought about safeguarding, but because of the nature of the circumstance, perhaps they've been delivering food parcels or making telephone calls to provide assurance to individuals. We wanted a range of information out there and available to people just to make them a little bit more alert to the idea of adult safeguarding, and also to know what to do if they had a concern about someone they'd had some contact with. Some of the work right at the beginning of the pandemic, some of the work of the board and the business team was temporarily suspended, recognising additional pressures on staff and on our partners, and also, in all honesty, for some of us, we had to quickly get used to a whole different way of working and how to do that across the partnership when we didn't all have the same system, and really understand how we do that effectively using IT. So at the beginning, it was a bit of a challenge, but now I think we're all much more comfortable and aware and able to use the IT and are seeing it as a real positive. There is now a more comprehensive training offer available in an e-learning format, and there's a plan to move to increase delivery of training online using webinars and podcasts as well as events. So all our face-to-face training stopped, and we've had to relook at what that offer looks like in order to make sure that people who need to access training around safeguarding are able to do that, and also that we can be responsive if there are significant and specific issues happening in Sandwell that we need to be able to share quickly. Okay, next slide, please. So again, continuing to look forward, as a board, we recently hosted an event with national speakers looking at challenges in terms of preparing for adulthood and the link to that and exploitation. This was well attended and has started some really positive conversations across the system about how we safeguard young people preparing for their adulthood, as well as adults who are already there in relation to exploitation and the risk that that potentially poses for them. And again, I've used that example because I think it's particularly relevant at the moment, where people are less visible, and we've seen an increase in scams. There are all sorts of opportunities that people will take that aren't necessarily helpful in situations where people are less visible, as I've said. There are now a number of task and finish groups running, looking at really key issues so that we can really evidence as a board the understanding that we have about the current situation, which is an ever-evolving picture for people with needs for care and support in Sandwell in these times. And the task and finish group that I've highlighted has a focus on the experience of adults with learning disability and autism in the patch, trying to understand how their experience differs, if it does, to the national picture. So at the beginning of the pandemic, we had some really alarming information about death rates. I think there was lots of figures being thrown around, but there was a suggestion that adults with learning disabilities were 136% more likely to lose their lives in the pandemic, that they weren't accessing basic healthcare and opportunities. So we wanted to really look at what's the picture in Sandwell, what is really happening here in terms of this very vulnerable group. So what we've seen is better liaison between professionals when adults with learning disabilities are admitted to a Sandwell hospital, that there's now one single hospital passport across the system, and so that people are clear, hospital passports are used to really highlight needs for individuals who may have really complex needs and not be able to share information in the way perhaps that we might do if we were admitted to a hospital. And there's also increased assessments under the LEADER programme and a commitment to share the learning for many of the desks across the partnership and a wider footprint, again made possible by the use of technology. Next slide, please. So I've also now done a slide on learning from our safeguarding adult reviews, or SARS, as you can see in the title there, across the partnership. And SARS, Safeguarding Adult Reviews, is one of the statutory functions of the Safeguarding Adult Board. The other is to produce the annual report. So I thought it was important that you got a little sense of what the learning is and what the position is, really SARS. So we're committed to embedding the learning and identifying in reviews undertaken earlier in the year in terms of SARS. We have 5 safeguarding adult reviews that have been commissioned this year, and the emerging themes, so the 5 that have been commissioned aren't completed, but what we're seeing coming out is failure to appropriately identify risk and or record it. So people may well have understood it, but they've not necessarily always written it down. A lack of clarity about how to escalate concerns, so who to talk to, and no clear evidence sometimes that this has happened, and sometimes an absence of multi-agency working. And I think again, some of the learning we'll be able to share very quickly, enabled by the IT. We'll develop programs that focus on those themes. I think it's also fair to say that they're not just Sandwell themes, actually. We've seen those nationally across the country come out. And Michael Preston-Shute, who's undertaken a national SAR review, also summarised some of the key learning points as being very similar to what we found in Sandwell. I share that because I don't want anyone to think that there's anything different going on in Sandwell that isn't going on elsewhere. I think what we need to do, though, is be really creative about how we ensure that learning is identified. Sue, I know you're on the call now. I haven't come to you at all. I don't know whether there's anything you want to add at this point.
No, that's very comprehensive. Thanks, Deb. If there's any questions, I'll be here.
Brilliant, thanks. Okay, next slide, please. Again, so the emerging themes again are challenging building relationships, where individuals can sometimes be seen as difficult to engage. And clearly a message is, it's not about the individuals, it's about how we all work differently with people to support people to engage. Information sharing, and again, sometimes not recognising self-neglect, which is a kind of high risk abuse, really, where the picture can change very, very quickly for individuals. Okay, next slide, please. Again, just so that I want you to know this because I think it's really good news. The Safeguarding Adults Board has commissioned a thematic review in partnership with Mike Ward from Alcohol Change and Professor Michael Preston-Shute, who I mentioned earlier, who's recently undertaken a national review of all SARS. He's actually going to come and work with us in Sandwell to look at the learning that we've identified and how we can better embed it, and also look at the key themes from a number of SARs. So we've got a number of those new SARs that are going to be done thematically, so there will be, as I say, key themes identified. And I think that's really, really positive. We have a leading expert in his field coming to Stanwell to do pieces of work with us as a board and as a partnership to really get this stuff right. And then in January, we're planning to have a board set and subgroup development session, bringing all partners together to agree and set our priorities for the forthcoming year, being mindful of COVID-19 and the challenges that this continues to present us all with when safeguarding adults with needs for care and support. And that's the end of my presentation. So thank you for listening. And now if people have got questions.
Yeah, I'd like to say thank you, Deb, for a good report, and I'm going to open the floor to questions. Kerry?
Yes, thank you, Deb. You mentioned about the 5 commissioned SARs. Is that a type of an audit?
It's like a detailed report looking at the circumstances as it relates to the death or serious injury of an individual, and looking specifically at whether partners or agencies could have worked better together in order to better safeguard. So it is a kind of an audit, but what we end up with is a full report outlining key areas for learning that then is monitored by the protection subgroup and reported onto the board on a regular basis, so that we can ensure that progress and identified learning is taken forward.
So do you audit besides those 5 commissioned SARs?
We, at the moment, the Quality and Excellence subgroup of the board, it doesn't do audit, but we are looking at an audit programme and to try and really get key information that underpins some of it. As I said, really, a bit more about a person's qualitative experience of safeguarding. So we're not doing it yet, but we are doing it. We will be doing it on the plan to do.
I have a couple of questions from the main report that we had attached to our agenda pack. Is that okay?
Fine.
Yeah. It was on page 6 primarily. It was about the 94% and 93%. 94% outcome fully or partially achieved, 93% risk reduced or removed. It would be actually good to know the percentage of those of the outcome that was fully achieved and where the risk was fully removed.
Okay,
Yeah, so get a benefit.
I think that's really helpful, Councillor Carmichael. So I will go back and I will get that information. But it's not always, we don't always measure that, but I can certainly ask that question and see what I can come back to you on if you're happy for me to do that.
Right, yes, that'd be good. Thank you. That'd be really good. Thank you. And I had another question. It was on page 18. It says there was a positive contribution of a specialist safeguarding practitioner that was employed. Does that mean we have a contract with an external person that helps out, or not? I'm not too sure.
Well, I need to look at that. Do you mind if I look at that and come back to that question?
No, that's fine. That's fine. I mean, you haven't got to answer them now. You can
after our presentation, and I get that email directly to you.
Yeah, that's fine. That's not an issue. Those were just things in the reports. Thank you very much, Deb. Thank you.
You're welcome.
Thank you.
Has anyone else got any questions? I will endorse your report, Deb, and thank you again.
Thank you very much. Good to see you all. If I don't see many of you before, I hope you all managed to have something vaguely resembling a good Christmas. Take care.
Have a nice Christmas. Okay.
Take care. Bye-bye.
Thank you. Bye.
Right, we're going on to item 9, the outcomes of the joint scrutiny board we had with Children's. I want to thank everybody who took part in that meeting. It's a long one, but very interesting, and a lot of things come out of it which we can take on board. Has anybody else got any comments they want to make about the meeting? No. Well, there is a few things from that meeting. The budget and management scrutiny board is taking on board the mental health of the workforce, looking at that. One of the issues what came to light, and the other three issues are coming to this board. A report on acute paediatric children's beds, a report on triage for child mental health, and
Are those this board or the children's?
This board.
Oh, okay.
We've had this discussion because I said to Deb, I thought they would have gone to the children's, but Deb's looked into it, and they are our board. I don't know whether you want to comment on that, Deb.
I thought
Yes,
Councillor Prince had said he thought they were going to his board.
Yes.
I'll just briefly comment on that, Chair. They fall within the terms of reference of the Health and Adult Social Care Board in the Constitution. Okay.
Okay.
But we did at the beginning, we all thought it was children's, and there was a detailed report relating to CAMS, which is another one we thought was children's, but it's adults. So I don't know whether anybody else has got any comments on those issues, or you accept it because you took it to the work programme for 2021.
Yeah.
So that's next. That will be on the agenda for then. Okay. Anybody? Michelle, you want to come in?
Yeah, thanks, Elaine. And obviously, I'm not an expert in terms of the constitution and what's in it. I just suppose I just don't want to create duplication because even though it fits within the scope of this board, I know because I'm involved in other, as I'm sure lots of people are on this call, that CAMS etc. is being spoke about in lots of other committees. So I suppose we just want to make sure we're not duplicating some really good work in multiple arenas, don't we? So I suppose it just get clarity on what is the correct, and if it is both, that's fine. But it'd be helpful certainly for me. I'm one of the system leads for CYP for the CCG, so it'd be helpful for me to understand where it sits. Otherwise, I'll be jumping to lots of different arenas. Thank you.
Chair, you could invite the Children's and Young People Scrutiny Board to come to that meeting.
Well, that's what I was going to say, Deb. We probably will do like joint meetings with the children's, because it does cover both committees. Has anybody else got any comments?
Only, Chair, to pick up on Michelle's point that we want to ensure with Councillor Priest that we're not actually duplicating work that's been done elsewhere. So,
I think we can get that off Deb because she's the clerk to both the scrutinies, aren't you, Deb?
Yes, I have advised Councillor Priest of the situation, and he's quite happy with the suggested way forward, Chair.
Okay.
Okay.
So now I think that's the end, is it? Is there anything else on the agenda? I've lost my agenda, Debbie. It's a close to the meeting. And I just want to say, oh, hang on. Do you want to come in, Elaine, with your glasses?
I thought I'd just wish you all a Merry Christmas.
That's what I was just going to say. Merry Christmas and a Happy New Year. And let's hope everybody on here has a better New Year. And Lisa, perhaps a quieter one?
No chance.
Later on in the year, maybe. Okay, I'll wish you all a good night. And oh, hang on, Elaine, back.
Ignore me.
I was going to say, have we got a funny app now? All right. Merry Christmas and Happy New Year to you all, and good night.
Good night.
Nice.